Good afternoon, everybody, and welcome to Health and Human Services Committee. Before we begin work on our two bills this afternoon, I'm going to have the committee introduce themselves. I will start over to my left with Representative Lemlin.
Hi, I'm Michael Lemlin. I represent House District 53, Chelsea, Randolph, Pittston, and Dresden.
Good afternoon. I'm Representative Dan Shigori. I represent House District 55, the communities of Hollowell, Manchester, and West Gardner.
Good afternoon. I'm Representative Annie Graham. I serve the people of North Yarmouth and the majority of Gray, House District 105, and the sky is such a beautiful blue today.
Good afternoon. I'm Representative Lucian Daigle. I represent House District 1, the pinnacle of Maine. Thanks for coming.
Hello, everyone. My name is Sam Zager. I represent District 116, which is part of Portland.
Good afternoon. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County. Beautiful down east Maine.
And we have Representative Griffin on Zoom. You want to introduce yourself?
Sure. Thank you so much. Good afternoon. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levan, and Keduskeg.
Thank you. And Representative McCabe.
Good afternoon. My name is Julie McCabe. I represent District 93, part of Lewiston.
And Representative Brito.
Hello, hi. I'm Flavia DeBrito, represent House District 64, part of Waterville and part of Winslow.
Good afternoon and welcome. I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, parts of Kittery and South Berwick, and I'm honored to serve as this committee's House Chair.
And I'm Henry Ingerson. I represent Senate District 32, the city of Biddeford, and the towns of Arundel, Dayton, Lyman, and Hollis, and I'm pleased to be the Senate Chair of this committee. We have two bills for work session today, all guided by our great analyst, Anna Broom, and our amazing clerk, Sophie Doobie, here today. And with that, we'll jump into the first bill, which is LD 2144.
All right. This is a resolve to establish the working group to prioritize wellness and mental health resources for heritage industries. This resolve creates the working group to prioritize wellness and mental health resources for heritage industries. There are 11 members on the working group, with 3 co-chairs from Agriculture, Conservation and Forestry, Marine Resources and HHS, who appoint the other members of the working group, which include the University of Maine Cooperative Extension and representatives of agriculture, fishing, forestry or logging, mental health services, provider organization, rural health or public health services, and organization delivery community services. The duties of the working group are to review existing mental health and wellness resources available to individuals in Maine's heritage industries, to identify gaps in the provision of services and barriers to accessing existing resources, to examine successful models from other states and jurisdictions, to develop recommendations for establishing sustainable funding mechanisms and service delivery models, and to explore opportunities for public education to reduce stigma around mental health issues and increase awareness of mental health services. The working group is required to submit a report of its finding and recommendations to this committee, to the Marine Resources Committee and the ACF Committee. The report is due no later than December 1st of 2026, and each committee is authorized to submit legislation to the next session in the 133rd. You heard from the proponents about the importance of heritage industries to the Maine economy, the physical demanding work, dangerous work, economic instability, long hours, weather, regulations, market forces, geographic isolation, and you also heard about breaking down the negative stigma associated with seeking mental health assistance. There was a recent UMaine Cooperative Extension, the first Maine Land and Sea Farmer Wellness Forum, with the sharing of best practices and development of partnerships, programming and policies to health and wellness. And the key takeaway was many individuals and organizations are working to support mental health, but there needs to be better coordination and communication. You also got testimony from PEI, which I kind of found exciting. And you got support from the 3 co-chairs. You got testimony from each of the 3 departments. There were some requests for amendments or additions to the bill during the public hearing. Consider individuals living with serious brain disorders within these industries and families impacted by untreated or unrecognized conditions. You heard that logging is different from forestry and should be separately represented. And there was also a discussion at the public hearing about the inclusion of gaps in access to primary care in rural industries as something that should be looked at. And also conversations need to be where people are, for example, on the farm or in mobile units, not necessarily in a doctor's or counsellor's office in the city. I think that testimony was related to the duties rather than the meetings. It wasn't 100% clear to me, but that's my understanding, is that might be something that they are looking for that to be included as part of the duties, but it's all up to you.
Could you read that last one that you thought was a duty?
There are the sort of mixed amendments or additions that are related
Yeah.
to membership and related to
Right.
duties.
Okay.
And one of the duties was around the primary care issue, and the other was about having conversations where people are. So
Okay.
mobile units actually on the farm, rather than doctor's or counsellor's office in the city. But I don't think the suggestion was that the working group had to meet on the farm, but maybe it was. I believe it was about the duties that these mental health services would need to be available in places where the folks that you're, in the subject of this would be able to get services
Yeah.
more easily.
Yeah, I think you're right.
Yeah, and it does sound like the primary care piece would be more in the duties, the inclusion of gaps in access to primary care in rural areas.
Yeah.
Didn't need to be a membership piece.
No.
I would suggest, and I think all stakeholders were okay with this, is just removing the forestry and just having logging. And that's the working group membership piece.
Well, should we have,
Can't they be both?
yeah, we should have both, I'm thinking.
If logging and forestry are two separate categories, they
Yeah.
are both heritage industries.
Yep.
Shouldn't they both
Awfully
be?
lonely out in the woods.
Yeah, I mean, from what I know, which isn't a lot, I was thinking more of the actual people on the ground doing the work, which seems to be logging, and then forestry, I was thinking was maybe just a guy walking
Forest
around and
management.
checking out trees, but I'm perfectly
They may
willing.
beg to differ.
I'm perfectly willing to include that. I mean, if that's,
And I don't know, yeah.
What about the TBI, or traumatic serious brain disorder piece?
I don't know. What do you think?
I'd be inclined to add.
Okay.
And the
To a duty?
testimony around brain disorders was that there be representation in the group, or that it be part of the,
Let's find it.
That's a good one.
Here it is. Working group also considers individuals living with serious brain disorders within these industries.
yeah, so it's not a member, it's just that it's a,
It's a duty.
So all of those maybe, other than the logging and forestry would be duties.
I think that was.
Pardon me?
The logging and forestry was
Was
about
membership.
membership.
Membership. that's
That one
right.
was clear.
That's what I said. I was just saying with the, all of these would be duties except for the logging and forestry.
okay.
Yeah, that's what I was meaning. That sounds like it to me.
Yes.
Well, as you know, Senator Moore, I am inclined as the analyst to bang on about duties, because I do feel that sometimes there's more attention paid to the membership than there is the duties.
Mhm,
And I think it's really important to consider both of them.
mhm.
Good.
Absolutely.
Representative Zager.
Thank you very much, Mr. Chair. I think this would be a step forward to have this group. I do want to highlight one of the things that came up in public hearing about the inclusion of gaps in access to primary care in rural areas. Why is that relevant here? Because a lot, in some ways, most mental health aspects, some aspects of mental health are delivered in primary care. And so while it's not exclusive to, while primary care is more diverse than mental health, of the mental health that is delivered, including some of, of the prescriptions that are for mental health conditions, huge percentage is done in primary care. So I wonder what the committee thinks about in the duty section, including something about, maybe in page 2, line 12, like gaps in provision of services and barriers, something in there, or maybe in the previous, item number 1, something about the existing resources, something to acknowledge as part of the charge from the legislature to this working group. Don't forget to look at all the places where there might be a lack of access to care, which could include primary care.
I think you should mention primary care though. Yeah, I think you should actually point that out as a duty since it seems to be an important one.
And I agree when we're looking at the wellness aspect of this report, because a lot of our wellness comes from the primary care.
Yes.
Thank you, Mr. Chair. I was unfortunately unable to hear this bill, and I think that this is absolutely outstanding that we're paying attention to these industries. And I agree with Representative Zager or Senator Moore that primary care, I mean, much of the work that's done in our rural areas are by FQHCs. And so that primary care piece, they also have mental health components in the FQHC. So the ability to be able to get to as many people as possible. I do have one question. And again, I apologize for not being at the hearing. But was there any discussion at all about migrant workers and the individual, whether, their needs, their health needs? And I'm actually looking at the sponsor of the bill, if there was any discussion around that.
Don't believe there was, unless people remember. Are you suggesting that as a possible duty?
I think that it would be a good addition to be add into the working group, because they are doing significant work, particularly during our summer months, and they are a part of the heritage industries. So if that would be okay, I think that might be a good addition.
I agree. Including it as a duty. If I recall, if my memory serves me well, also at the forum, Farmers Wellness Forum, there were representatives talking about rural and migrant mental health as well. So I think.
When you look at the membership of it, it is saying one member representing the state's agricultural industry. And a lot of our agricultural industry is the migrant workers. So maybe that could be part of that appointment, because we're going to start getting to such a big group here. It's going to be really hard to, and if we're going to say specifically a migrant worker, it's really hard when they're seasonal. So they may not always be available to meet, to work through this and meet the
It could be
deadlines.
part of the duties.
I was thinking it could be a duty.
Yeah.
It could be a
Yeah,
duty to
I
look at the
agree.
unique.
And I have no problem with
the
that. Yeah,
unique,
that's what I'm thinking.
issues facing
Yep.
migrant workers.
Yeah, I agree. I think that when we talk about primary care, there is a whole migrant health program.
Yes, there is.
So that looking at that in the duties would be, I think, a good idea.
Any other questions, suggestions? I know the departments, agriculture and HHS would be convening this working group. I don't believe there's any other suggested amendments coming from those departments. I see nodding no, so, okay.
So
Marine resources.
what's that,
Okay.
TBI? Did we,
Add that to.
did we agree that? Are we talking about bringing to someone on the membership, in the membership to specifically discuss or to represent those individuals with brain disorders, or is that part of the duties as well?
Part of the duties.
Duties.
I think
Okay,
it's part of the duties.
Duties.
so
So Marine Resources.
what about Maureen?
I was just asking the
She's
Marine
fine.
Resources if they had anything, are they fine with what we've presented? Okay.
Great.
And kind of looking around the room there. I would make a motion on LD 2134 ought to pass as amended.
I would second that.
Do we have a motion on the floor? Or to pass as amended? Ready for
That
a
was-
vote?
That was 2144.
Okay.
I said 34, I think. 44.
All those in favor? Thank you. We'll next go to LD 2134.
All right, so this is an act to create an exception to the prohibition of tobacco sales in retail establishments containing pharmacies for certain small grocery stores. So this bill creates an exception to the provision of law that prohibits a retail establishment that contains a pharmacy from obtaining a retail tobacco license. Under the bill, a grocery store containing a pharmacy is eligible for a retail tobacco license if the following conditions are met. The first, the store has no more than 26,000 square feet of customer accessible sales area and operated primarily as a grocery store. Two, the pharmacy was established in a grocery store prior to July 7, 2025, which is when the law went into effect. No, when it was signed. The pharmacy is independently licensed and operates as a separately demised leased space. All tobacco sales are made from the grocery store with a written lease and a separate pharmacy license. All the tobacco sales occur outside the pharmacy's leased premises and through the grocery store's separate point of sale system and from a separate inventory. And the grocery store complies with all other requirements under the provisions governing retail tobacco licenses. The bill defines customer accessible sales area, so this is the 26,000 feet, as the total floor area open to customers for the sale of merchandise and does not include offices, bathrooms, or the pharmacy. It defines grocery store as a retail food store that offers for sale a variety of food for home preparation and consumption and derives a substantial portion of sales from food. And the law also removes references to the sale of tobacco through vending machines or the practice of giving away tobacco products in the course of trade, both of which were made illegal by LD 1938. So you heard from the proponents that this applies to 8 business pairings, independent storefronts and independent pharmacies leasing space that rely upon each other for infrastructure and customers. And you do have the copy of the maps from both the Pharmacy Association and the Main Grocers and Food Producers Association. They
Maps.
did it together. The bill, so it's Oakland, Randolph, Cornish, I can't say it. Corinth, is that how you pronounce it? I don't know. Till I got there, I suddenly realized I didn't know. Herman, Fort Kent, Presque Isle, and Unity. The bill would grandfather those that existed prior to Public Law 2025, Chapter 493 being signed. Customers have expressed frustration at having to make multiple stops, and retailers will have to decide which one to keep, the tobacco license or the pharmacy space. So you had some testimony opposing it, that only 3 of these locations are the only pharmacies in town, and they would hope the store would stop selling tobacco. It undermines the tobacco prevention effort from LD 166, and the health focus of pharmacies. And you also had an opponent that said they would prefer to reconsider the original law rather than further create further patchwork regulation that also protects existing businesses. So the technical thing, I just want to explain about the vending because it's probably a little bit confusing as to why that is there. So the vending machine and the free distribution language in Section 2 of the bill, the committee had 2 bills at the same time in 2025. LD 166, which is the pharmacy retail, and LD 1938, including the removal of language around vending machines. So LD 166 enacted this subsection 6 that you're seeing amended, which made pharmacies ineligible for a retail tobacco license. And the drafting of that bill mirrored what was in the other sections of the retail tobacco license subchapter at the time. So that meant that all the vending language was just standard and went in with it. 1938 removed the references to vending machines and pre-distribution, but that new section, subsection 6, was a new section that didn't exist yet when LD 1938 was being drafted. But also, you never know what's going to be enacted. So just say one of them had been enacted and not the other, then you would want the language to sort of match. So that's why that's there. Perhaps a slightly more important technical issue, which is not on your sheet, is the timing question here. So the LD 1966 has an effective date of April 1st, 2026. And I believe you did that related to the licenses. So that's why you have that. This bill, if you move forward with it, would go into effect 90 days after adjournment. Just letting you know that that's, there's a bit of a mismatch there. And then the committee requests for additional information. This is the maps. I sent this question to the Maine Pharmacy Association, the Maine Grocers and Food Producers, and the Cancer Society. And the reason I did that is because you asked all of them the same questions, and I didn't know whether the answers would necessarily be exactly the same. So you do have the answer here from the Cancer Society about which 3 there isn't a close pharmacy. And you did ask for the size of the independent stores, but I don't think we got that. I do know that the IGA in Randolph is 26,000, so maybe that's the reason for the 26,000. And we do not have a fiscal note yet.
Any questions or comments on this bill?
I'll make one comment, just as a comment.
Go ahead.
I mean, I'll make one comment just really as a comment. I really would have preferred to repeal the first bill altogether to keep our businesses in place, but that's my comment.
Ship has sailed.
No, not yet, but anyway, April 1st. Gosh, it's a sign.
Representative Zager. Go ahead,
Thank you,
Representative
Mr. Chair.
Brito.
So my question is what is the mismatch of the dates? Like what is,
So when LD 166 was enacted last year, you put an effective date on it. So when a pharmacy would, or a grocery store with a pharmacy would no longer be able to have a tobacco license. And I guess the license must be April 1st. So there was an effective date put on that. And I'm assuming that that's because that's when the licenses come up. I don't know if that's the tobacco license. I know nothing about pharmacy licenses. So that isn't changed by this. And so this bill, if it moves forward, would be 90 days after adjournment. And so that could be the middle of July. So I don't know what that means for the 8 pharmacies or the 8 grocery stores on April 1st.
Yeah. Representative Zager.
Thank you, Mr. Chair. Just on that last point, I assume there would be we could put in language to match them up to, even though it wouldn't become effective, we could say like nobody would face sanction as retrospectively. Or something like that.
There's probably a couple of options. One would be an emergency, and the other would be, I suppose, a retroactive date. I suppose you could make it retroactive to April 1st. I'm sort of thinking of that as I sit here.
Okay.
I think that would work. An emergency would definitely work, but it's up to you. But that obviously has the 2/3 issue. But you probably could have a retroactive date.
It's not an emergency.
It's not.
No, they're not.
If I might, Mr. Chair, Ma-
Go ahead.
Thank you. General observations and just reflection about this bill. This is an extremely difficult bill. There are very few things that have been as harmful to human health than the notion of smoking tobacco and using it in the way that we have. And we have decades of health harms, economic harms, community harms as a result of tobacco use. At the same time, there are other aspects of health that have to be considered. And so I think in looking at the relative balance of merits, we have to look at other things like access to pharmacy, medications, vaccinations, and other things that pharmacies provide, particularly in rural Maine. In this committee, we look after the health of all Mainers. And while I'm not from a rural district, I want them to be as healthy as all Mainers. And so the question for me in weighing this bill is the amount of pro-tobacco element of this bill in allowing it to be sold in the same structure by the supermarket at a different till or register. Is that outweighed by the access to health care through the pharmacy? And after thinking about it for a weekish and talking with folks, I'm coming down on the side of supporting this bill to allow the grandfathering, but it is with tremendous concern for the health of people who are still struggling with tobacco dependence and their families, etc. So while it's a contradiction, while there is an inherent contradiction in principle to sell tobacco, in a pharmacy, and to some extent in the same building where there is a pharmacy, I think that is outweighed, in my mind at least, by the value of ensuring more ready access to pharmacy care, knowing that somebody might have to travel. If we didn't grandfather these 8 businesses, some people might have to travel. I think we heard 22 minutes further, and that's assuming that the roads are great. It's not icy, and maybe they've already traveled 30 minutes to get to that pharmacy in Corinth or wherever. And so I think about all of that, and I try to think about not my, and I have access to 3 pharmacies within walking distance, basically. That's not the experience of these folks. And so I'm trying to, well, I hope that the customers who are going to these buildings to buy tobacco products will be able to free themselves from that. I think that for me, the balance of merits here is on the side of ensuring access to pharmacy care. Thanks for your indulgence, Mr. Chair.
Representative Daigle.
I agree with the health consequences of tobacco are extremely high. And I would advocate not selling any in Maine at all if that was my prerogative. That's not the case. I've also done a lot of research on the adverse effect of alcohol that's marketed in these same pharmacies, and there's no law against it. And if we consider the health impact of one compared to the other, there is this difference, but it's really not that big. So if we're going to suppress one thing without suppressing the other, to me, that's kind of hypocritical. So adding another restriction, I think, is just wrong. And then we look at the real return on our investment. Is that really going to make a difference? And I don't think it will. So I would vote yes for this bill, but like Representative Zager says, we get reservations.
Representative Lemon.
Thank you, Senator. I'm going to vote in favor, but I have issues also one, I'm deadly opposed to the sale of tobacco or any smoking in Maine. However, the way I look at it is I don't believe that if we didn't pass this bill, that the people who were going to buy tobacco, and one of these stores is in my district, Randolph, that they're just gonna, I don't believe one person in my district is gonna stop smoking because of this bill not passing. And since that's the case, and I'm almost positive of this, talking to people. So since that's the case, this bill's not going to help anybody stop smoking. And I surely can't see the pharmacy in my store happens to be a little tiny mom and pop. And I sure in heck can't put them out of business. I think that would be a tragedy for them to lose their business because of this not passing this bill. So that's why I'm leaning, because I have to protect small businesses in my district. And nobody can prove to me that one person would stop smoking if this bill were not to pass. And so I just wanted to share that. And that's it. Thank you.
Representative Shigori, did you have your hand up?
I did, but I think Julie.
Okay. Senator McCabe, go ahead.
Thank you, Mr. Chair. This is also a really hard vote for me. My grandma died of lung cancer, and I have two aunts and uncles who died of lung cancer. I don't want anyone to continue smoking or start smoking. However, I think that at present we're forcing small business owners to also make an impossible choice. And I really don't want to see more pharmacies close in Maine, especially in rural areas where that pharmacy can provide many vital essential services for Mainers. And I think that we have, if we don't pass this in its very tailored fashion stance as it is, that we could be undermining other really important public health goals. So that's where I am.
Representative Shigori.
Thank you, Mr. Chair. I'm having a really hard time with this one too. I don't like it, but I think on balance, we should pass it. I'm especially glad that there's a grandfathering provision in it. And because we don't want it to be as the nose of the camel under the tent. And also, I propose that we at least consider that they couldn't move as part of the grandfathering provision.
Representative Graham.
Thank you, Mr. Chair. Yeah, I concur with all that has been said. As a pediatric nurse practitioner who strongly believes in the need to really prevent people from smoking and help them with smoking addiction, and working for the American Cancer Society for several years. And I've also, while I was there, made a real commitment to the areas that had the highest incidence of cancer, not just lung cancer, and that was Aroostook County and Washington County. But I also have grave concerns about our rural population and access to healthcare and access to pharmacies. So it seems like it goes against all that I believe. But I agree with my colleagues on the horseshoe here that this is a small town. These are small towns. These are moms and pops. This isn't a big raging national pharmacy chain. So I too will support this bill.
Representative Brito.
Thank you, Mr. Chair. I agree with all my colleagues here today. It is a very tough decision to make. So I have a question. So a part of the grandfather, so if the pharmacy sells their business, would another pharmacy be able to come in and still be part of the grandfather?
That's not how I read it, because it says the pharmacy was established by lease agreement within the retail establishment location prior to July 7, 2025. So I think if that pharmacy goes out, let's just say the pharmacy goes out altogether, then it would become a retail establishment that doesn't have a pharmacy, so they wouldn't be able to sell tobacco. But I don't see that a new pharmacy could go in and replace the one. So it, became a different ownership. I don't see how that could go in. So if the pharmacy goes out, then you're down to 7 or whatever.
Yes. Representative
Thank
Meyer.
you. Yep. Thank you, Mr. Chair. So the sale of cigarettes in a pharmacy location is just antithetical to health promotion and public health and all of the work that this committee has done in support of tobacco control and anti-smoking legislation in general. And it feels like a step backward. And it feels decidedly like big tobacco is getting a win here. But like Representative Zager and all of my colleagues here behind the horseshoe, I have spent a great deal of time since this public hearing weighing what it means to lose a pharmacy, particularly in rural settings. This legislature and several before us, we've expanded the role of a pharmacist. We've nationwide pharmacies now exist as sort of ancillary to primary care, in that for chronic conditions like cardiovascular disease, hypertension, diabetes, where pharmaceutical management is the way folks are kept alive, the pharmacist operates ancillary to primary care, and in some ways as a primary care provider. So all of this has been weighing very heavily on my mind as I have tried to get to a place where I could support the bill, which I will be doing. I just want to also say to anyone, big tobacco and anyone who's got designs on further rolling back the work that we have done on behalf of the health, safety, wellness, and longevity of Mainers. This is the first and last time I would consider anything along these lines.
I just want to say a few words. I haven't got much to add to what's already been so well put, so eloquently. This is a really, really tough bill for me to consider and think about. I think this committee, even before I was here, this legislature before I was here, has been working for years to restrict tobacco sales and tobacco use, because we all know what we know. I don't think there's a family member. The committee members probably all have loved ones and family members that they've lost to cancer or have been sick from cancer related to smoking. We know it's a huge public health threat. On the other hand, I too have had to weigh, do we want to lose these community pharmacies that are in some cases primary care providers? We've expanded what pharmacists can do and through this legislation, through this state committee. And those places are very important to small communities in rural Maine. So I'm going to come down on the side of supporting this legislation, but I want to make sure we have really strong language in the bill that only allows these 8. I'm supporting the grandfathering and also would like to add that the location, the geographic location, not change. And I don't know if anybody's got any other guardrails around this that they might suggest.
Well, I think the only other guardrail would be being able to backdate it to the April 1st.
Okay.
Why don't we just put emergency on it?
I'm afraid we won't get the 2/3, maybe.
I don't know. With a unanimous report out of this committee, why wouldn't we?
I would think that,
No, that's fine.
if I may put it out there, I was talking to sponsor this morning that you assume this would be an emergency legislation. Is that true? Would you like to come forward?
Turn the mic on, yeah.
Thank you, Senator Chip Curry, and I greatly appreciate your deep consideration of this bill. Yes, so it either needs an emergency or some way to handle the April 1 deadline. We will have a, I've got a Uni pharmacist, he can't get his lease right now, so, and as soon as April 1 happens, he won't be able to be open. So anything that can handle that, if there's a creative way to backdate, that's great, or a 2/3 is all I knew about as a strategy. Thank you.
Question for Senator Curry?
No, I mean, yeah, question. If we go ahead and amend it to have an emergency right now, if for some reason, and I don't see how, like Representative Meyer said, with a unanimous vote out of committee, I don't know how we're not going to pass this. Could we not, if it didn't get the emergency, can't we make a floor amendment to backdate it? Are we able to do that?
Sure.
Right. So we'll cover it either way. So why not go for the emergency now? I don't see why it wouldn't pass.
Okay, I think we've,
Representative Zager, do you have something you wanted to add before we make a motion?
Thank you, Mr. Chair. It's more of a technical question, though. I don't know if we're there or if but like, even if we pass it with the emergency, don't we need to backdate it? Because we're not going to adjourn before April 1st.
No, you wouldn't need to adjourn if you have an emergency on it.
Oh,
and as
right,
long as
right,
it is
right, okay.
signed by the governor, it would go into
As long as
effect.
as long as the governor signs it.
Yep.
Otherwise, okay.
It's actually the cleanest way.
Okay.
The emergency.
Fair enough.
The anything that's retroactive always makes me a little sketchy. I mean, I was checking with Sam and we think it's okay, but an emergency is way cleaner.
Yes. Senator Moore had a motion.
okay, I think we've beat this baby to death here. So I would make a motion of ought to pass as amended, which would be adding the emergency preamble, making sure that it's limited to these locations that are grandfathered, cannot be sold to someone else. I think that was all of the amendments that we had.
No,
think it was moved.
no move of
No,
locations.
Yeah, move of locations. Ought to pass as amended.
Second. We have a motion on the floor, ought to pass as amended. All those in favor?
All righty.
Okay.
Okay.
This is LD 1583. This is an act regarding home healthcare services ordered by a physician licensed outside of Maine. As you know, when amendments go back and forth between us and the revisor's office, there are lots of little changes. I did ensure that the three organizations and folks that worked on this were okay with the final product, that it said what they expected. If you remember, this is it requires a home healthcare provider to be licensed and certified by CMS. That language looks slightly different than it did in the original amendment, and now says licensed, certified as a home health agency, because the original language was unclear. The order can only be up to 90 days. The physician must hold a license in good standing from the jurisdiction where that physician practices. That hasn't changed, and the healthcare provider who is providing the actual service to the patient must verify that the license is in good standing and maintain that on file. That was also in the original amendment, or the amendment that you voted on. The order must be pursuant to an in-person physical exam. That also has not changed. And the home health care services ordered by the physician are limited to the medical purpose and clinical scope from the results of that exam. The physician and the home health care provider comply with the standards established by CMS. That was also in the original amendment, although again, it says home health agencies, not the original language. And then the exemption for the physician. So this is the physician side. Exempt from licensure by the two titles, the DOs and the MDs, solely for the purpose of ordering home health care services for the patient, as long as, again, the 90 days, they can provide telehealth only to the patient for which the order was issued. The physician orders home health services from a home health care provider that is certified and certified by CMS. And the physician only orders home health care services while the patient is receiving home health care services. I know that sounds really very circular, and I went round and round with the revisor's office, but what it's basically saying is if the person ends up, let's say, in the hospital, so they're no longer receiving the home health services, then the doctor can't provide different kinds of services. So they can only provide services to the person when the person is receiving home health services, nothing else. So it is really awkward. And then the violation language, that has not changed. If they're found to be in violation of any part of this, then they lose their exemption. And then we had to move the fourth subsection 4. It had been sort of tacked on the end of subsection 2. Revisor's office didn't like that. So now it's really just to say if you don't follow what it says here, then you're not authorized. It's not particularly necessary in the sense that sort of that's the whole point of the rest of the law, but that was really important to the advocates who worked on this language and then the rulemaking language. So the changes are sort of technical and around the edges from what you saw, but this is the final version, and it was a unanimous report, so it should be all good to go.
Okay. I'll entertain a motion to adjourn. Those in favor?